some over there as well. For folks that don't know what Whole Health is, we're an independent pharmacy banner based out of Ontario. We do have pharmacies across the country now with representation in New Brunswick, Ontario, Alberta, Saskatchewan, and British Columbia very soon. So if anyone wants to learn more about Whole Health, please reach out to myself or to Dean, and we're happy to share more information about the banner. My name is James Morrison. I do operations for Whole Health, and Dean Miller is our CEO and president. I'd like to also introduce our panelists for tonight. So we have from 3 of our pharmacies. So we have Samar from TMC Pharmacy in London. Samar is a pharmacist and an owner. Good evening, Samar.
Good evening. Thank you for having us today.
Thank you for coming. We have Rahim Dalla, who's also a pharmacist and an owner, and he's in Ottawa at Hybrid Farm tonight. Thank you, Rahim, for joining us.
Thank you.
And closer to where I am, in the middle of Ontario, we have Jag and Jasneet. And I see they're in Intrepid Clinic, which is next to Cooksville Whole Health Pharmacy in Mississauga, Ontario. Jag is a pharmacist and an owner, and Jasneet is a pharmacist at Cooksville. So thank you both for joining us.
Good evening.
So Dean, before I turn it over to you with a bit of a preamble and some comments about Alberta, I just wanted to share some information that one of our Alberta pharmacies sent in before this. And as you know, COVID testing is now over for pharmacies in Alberta. However, Ahmed and Doa out of My Day Pharmacy in Alberta wanted to send a note, although they couldn't join us due to scheduling conflict tonight. They wanted us to share a story about testing from their pharmacy, which is My Day Pharmacy, Stony Plain, Alberta. So they really enjoyed offering COVID testing to the community at the pharmacy. They mentioned that the majority of the folks coming in for testing were like parents of school-age children or caregivers of individuals. There was a number of patients coming that were massage therapists or physiotherapists, but a large group was parents of young children who were attending school, but then those parents also needed to make sure it was safe for them to visit grandparents. So that was a lot of the testing they were performing. They did share a story of one patient that they tested, and after they assessed the patient and tried to bill for the testing, it was rejected. The claim was rejected by Blue Cross in Alberta. And they found out that this patient wasn't honest about having symptoms. So they were assessed at one pharmacy, and that pharmacy declined to test them. And then they were dishonest with Ahmed and came in for their test. So I know that's a concern for some folks here in Ontario as well about honesty of individuals seeking testing at the pharmacy. In the end, that test result came back negative. So the patient did not, in fact, have COVID, fortunately. So Dean, at this point, I'll pass it over to you maybe for some opening remarks on why we wanted to do this webinar, what does COVID testing mean here in Ontario, and perhaps some thoughts on what happened in Alberta.
Yeah, thanks, James. And from myself, Dean Miller, as James says, I'm the president of Whole Health Pharmacy Partners. And tonight, we're going to do things a little bit different. For those of you that have joined us before, you'll know that we run a series of webinars through the year. And what makes it truly unique is that we open up these webinars to anybody. I mean, whether you're a pharmacist, whether you're a pharmacy technician, whether you're a student, whether you're with corporate pharmacy or an independent, it's just part of our personality here at Whole Health is we do open up this webinar series to anybody in the pharmacy profession right across this country. So as James said, I'm going to monitor questions this evening. We have collected quite a number of them from all of you. So we have quite a repository of questions already, but certainly use either the chat box or the Q&A box at the bottom of your screen if you have additional questions. We'll kind of make the assessment of whether we're going to get into those questions anyways, or I'll try and interrupt James, who will act as our host tonight, and deal with them on the spot. So I think this webinar tonight as well is sort of Pharmacy's version of the US election. It's been very divisive. You know, whether you're in Alberta or whether you're here in Ontario, which are the two provinces that have okayed COVID-19 testing across our country, you know, it appears to me that you're either strongly on one side or you're strongly on the other. So you're either opposed, strongly opposed, or you're strongly supportive of it. And tonight, you know, we've gathered a group of pharmacists that are strongly supportive of it and have been conducting testing for a number of weeks and even months now. So we're going to get insight from all of them tonight. As we said, lots of questions that we've got already, you know, voiced by all of you, but to date, and you know, as of today, the status across this country is still kind of the same as it was. Have taken the bold step to allow COVID-19.
So, Dean, we're pretty much lost you now.
Be back.
I think we're having a few times back here, but what I was just saying is that we've had two provinces across this country participate in asymptomatic COVID testing, one being in Alberta, one being in Ontario. So the whole initiative around COVID-19 testing has been a strong advocacy position from a lot of the provincial pharmacy associations. The ask went out in Alberta, the ask went out here in Ontario, and both coincidentally with Conservative governments. And the initiative began in Alberta mid-summer, started in Ontario in the latter part of September, and in Alberta, it gained momentum up to, I believe, about 250 pharmacies. And then it was abruptly stopped a little while ago. And you know, I do know that we have people from Alberta, you know, watching us tonight. If anyone wants to provide any insight, that would be tremendous. But you know, it's a very tough assessment to make when you're looking at advocacy, which obviously our associations do on our behalf, and they strongly support pharmacy in many things. But when you hit or you trip upon very controversial issue like this, it's tough to satisfy everyone. But you know, for the most part, I think it really showed that Alberta pharmacists stepped up and shined in a big way. And we're doing the same here in Ontario. One of the questions that we get all the time is, how do I participate? And I think we're going to get some insight from the panelists, so I'm not going to spend too much time on that. But certainly, you know, one thing that happened just today was that our Premier, Doug Ford, said, hey, you know what, 50,000 tests a day. We're not really sure at this point where COVID is going in this province. Let's try and increase that up to 100,000. The last word from our association here in Ontario is, could there be a phase 3 of testing? Could we include other pharmacies across this province? I have to think the answer to that is probably going to be yes. You know, Alberta, much smaller population base, certainly had a lot more pharmacies participating than we have here in Ontario. So, so with that, James, I'm going to kind of throw things back to you. As I said, I'm going to monitor the chat line. and the Q&As. I'll pass questions on to you, so please feel free to ask as many as you want. And James, let's go. It should be fun.
Great. Sounds good, Dean. And for the audience, you mentioned about phase 3, but we haven't really got into what was phase 1 or phase 2. So let me just say that there was an initial rollout of COVID testing in Ontario, which we called phase 1, and that included Hybrid Farm and Cooksville. There was a phase 2 that's now well underway, which included TMC Pharmacy in London. So we, as a banner, Whole Health has half a dozen or so pharmacies involved in COVID testing in different parts of the province, some of which were from the initial group, which was phase 1, and then the remaining are from phase 2. And as Dean mentioned, we learned today that phase 3 might be on the horizon, but it's not yet fully decided. So let me start with posing some questions from my panel. So I'm going to ask this of each of you, all 4 of you. So this came in from an audience question before the webinar. So do you feel like you're contributing to protecting Canadians from the pandemic? And what was your motivation to participate in COVID-19 testing? So Samar, would you mind taking that question first?
Sure, yeah. So I guess your first question was if we feel that we're kind of benefiting the public. And from what I've seen so far, I think we are. And actually, an example comes right to mind is the very first test we actually did was for a long-term, someone was visiting a long-term care home, and they actually came back positive. 3 days later, we got a positive result. So just right off the bat, you think that, you know, that individual was asymptomatic, they had 0 symptoms, they had no idea. And had they gone into a long-term care home, you can imagine that an outbreak may have occurred, right? So just that example alone just kind of makes me feel like we are definitely benefiting, we're helping. A lot of people are trying to travel, of course, and it's stressful for them, and we're here to kind of give them a hand and give them the results they need before they depart. So I have found that kind of, it's almost a feel-good feeling, so definitely feel like we're definitely helping out.
Thank you, Samar. We'll go to you next, Rahim.
Yeah, to piggyback, I think what motivated me to do this is that we're healthcare professionals. We're stepping up to the plate. We're pharmacists. We are resilient. We are adaptable, and we evolve. And I think you see it when doctors left their offices and we were standing in the front lines. I think as a pharmacist, this is our duty during a pandemic to serve the public and to serve our communities. And it's just showing our strength in our profession. And like what Samar said, like patients are coming in, like they're sitting down, they're like, I can't believe how easy this is. This is so much better than going to the COVID testing centers. And like in Ottawa, for example, like the testing centers were backed up for hours and hours. Some people had lawn chairs sitting outside waiting to get tested. And as soon as they rolled out the pharmacy program, I think it helped with the numbers. So we're definitely contributing. I think it's really positive, and I'm proud of our profession for really advocating for this. So.
Thanks, Rahim. That's great. And Jasneet, I'll go to you next, and then we'll go to Jag last. So when we look at your motivation, Jasneet, I'm hoping it's not that Jag made you do it. Go ahead.
I think definitely, like as a new pharmacist, just being able to, I guess, serve the community. And as community pharmacists, we're so accessible. And so a lot of feedback that I've been getting from people I've been doing the tests on is that compared to some of the other pharmacies, like the big names, they feel that we are very efficient and we're very easy in the sense to book a test as well as get it done. So I think just being able to serve the community and just be really accessible and help them out, either if they're visiting a long-term care home or traveling, which is what a lot of the people that we have seen. I think just being able to help in that sense, and also take away, from a bigger perspective, take away the pressure from some of the COVID centers in Mississauga, so that, you know, we're able to see the asymptomatic people who, you know, kind of takes pressure off some of like the big hospitals as well. So I think just in a general sense, helping the greater community, I think that's been very rewarding.
Yeah, that's great, Jasneet. And you mentioned something there about, you know, giving an alternative pharmacy location to the big boxes. Jag, have patients mentioned that to you, that they found that coming to Cooksville to your whole health pharmacy, that it was like a safer or a better experience compared to what they were seeing at other pharmacies?
Absolutely. I think one of the, I guess, the side effects of COVID is physicians not seeing patients as much in their clinics, and we're located within a medical clinic, so we have some extra space. We had rooms that are not being used. We have a waiting area that, when prior to COVID, we might have 20 people waiting in there. There's a maximum of 3 or 4 people in the waiting room now. So I think the experience for a lot of people is a lot better than going to an assessment center. They don't have to wait outside in line. We were able to book appointments and get people in and out pretty efficiently. So I think the experience for everyone has been pretty good. I mean, the part that's out of your hands is the test results and when they come back, but that's something where we try to manage as best we can. But the experience within the clinic, I think, has been positive for everyone.
Great. So the next question, maybe I'll go to you first, Rahim, is how was a pharmacy selected to be a testing site?
I believe you guys reached out to me, Whole Health and Dean, and one of the students you guys working with. You guys reached out to me and said, would you like to participate? And I 100% said yes. I think this is it's a great initiative, and I'm glad you guys were very supportive in that, and looking to me as like a new pharmacy too to help support the community. So that was my initial introduction to this.
Yeah, and Samar, what's your perspective on that, on how the pharmacy was chosen?
Yeah, I remember a month ago we got an email from you guys, actually, from Whole Health. It was more of an interest form to fill it out from the OCP, and I filled it out. I didn't really think much about it, and then here we are 3 weeks later, and
yeah,
got an email mentioning, would you be interested? And I said, of course we would be. So I appreciate the support, really.
Yeah, so one correction there, Samar, you said OCP, it was OPA.
OPA, yes, it was OPA.
So
yep.
The association did a call for pharmacies, and the interesting thing was, originally for the phase 1 pilot, it was directed to particular regions. So they needed pharmacies to test for Peel, for Ottawa, and for Toronto. So that's what Rahim was talking about, where our office team reached out to all of our pharmacies in those regions asking if you're interested. And we had overwhelming support from our pharmacies. Pretty much every single one was interested in offering the service. And then phase 2 came. Phase 2 came, OPA has a registration link where Samar would have registered TMC Pharmacy, and they're still taking expressions of interest. So if you're listening to this and you want to get on the list, you're welcome to reach out to me. And I can send you that information, or to OPA. And what happens is, or my understanding is, the ministry is, when they decide they want a testing site in a particular region, then OPA looks through their list and finds pharmacies that match that demand. So Jag, I'm going to give this next question to you. So how is a pharmacy compensated for the service, and how do you claim those fees?
So compensation for the services is twofold. I mean, there's a compensation for the assessment, which is done over the phone with patients, where we go through a series of questions to determine patients' eligibility to come into a pharmacy to get tested. So that process is something that we are able to bill for and get reimbursement for. And the second component of it is for a patient that is actually coming in to get tested because they are eligible to come to the pharmacy. We're able to get reimbursement for the actual specimen collection. Each component is one's $20, the other one's $22 for each individual component, and there's also support in place for the transportation of these specimens to the lab for the costs associated with that. We're able to get reimbursed for that as well. In terms of how it's done, very simply, just like a med check or a flu shot, how you would bill that through your pharmacy software to the ministry, and you would get real-time responses and about if there's any errors and things like that, we get real-time responses so that we can correct them and get the process going.
Yeah, that's true. And one thing about this service is that, like naloxone kits, there is a way to bill if a patient doesn't have a health card. So if they're here in Ontario and they needed the service, but they are not a resident that has a health card, you can still provide this service for them. So question, maybe I'll go to you, Samer. So your pharmacy is a new business. You're turning 1 year old soon.
Yeah.
So congratulations on the upcoming anniversary. But a question is, what was the impact on the business, and what is the demand for testing? Did you need to bring on any additional employees to support this service?
So we didn't bring on any additional employees. It's me and my partner, Enes, right? So we're both here every day. Before we started, we obviously were a little worried. We figured that the second we go live, we were going to have, nonstop phone calls and having to do the assessments and the tests. So we were kind of splitting the day. So we decided that we're just both going to come in the whole day, like the whole 10-hour shift. And the first day that we started, yes, the phone was ringing off the hook. So kind of one of us was dealing with the phones and doing the assessments, and the other was managing the day-to-day dispensary stuff. So it was definitely a little challenging in the beginning, but I think we got a grip on it now. We're pretty efficient with scheduling and doing the assessments. We have an online form for it as well. So we thankfully didn't have to bring anyone in. We kind of have a grip on it right now. But it was definitely challenging, but kind of exciting at the same time.
Great. Yeah, that does sound exciting, with both of you stepping up and covering off the hours and supporting your business. So a real project for the two of you to undertake. Rahim, how about you? Like, did you see any impact to your business, or any changes you had to make this happen?
Yeah, I see a positive impact. I mean, it's bringing a lot of new faces into the pharmacy, which is obviously exciting when you're kind of new and young and nobody really knows about you yet. So they're always a treat to come into a new place. Didn't have to make too many changes. The first couple rounds that I did bring on, I kept my tech here, and she was helping out with the specimens, the what's it called, the Kroll documentation and things like that. After that, I got a little bit more streamlined. I'm starting to use a MedMe, which is like an app that allows for the online booking. So that's really streamlining things. That's making me super efficient. That I stay 1 hour after, 1 hour before work, and it's in and out, 5 minutes in and out. So it's super efficient, and yeah, it's really helping the business.
Yeah, MedMe is really, I mean, they bring a lot of experience from Alberta, where they were supporting a number of pharmacies. So it was a very smooth transition to support this service in Ontario that follows a very similar layout to what was happening in Alberta. So I'll give this question to Jasneet. So how did the regular patient population at the pharmacy respond to Cooksville becoming a testing site?
I think in general, the reception from the general population was there. I guess they were interested to see what we were doing and wanted to see if it also helped to see whether or not they were eligible to get testing done. So I think it just started a dialogue and a conversation. And some people who maybe didn't know that we were offering it, but they maybe knew someone who needed testing done, or they were traveling, or they knew someone who had to go visit a long-term care home. I think it just started a dialogue, and it also helped attract, I guess, more people into our pharmacy to get the testing done. And so I think overall reception was pretty positive. And I think if there's anything else you'd like to add.
Yeah, no, I think it has been a positive experience so far. We kind of limit our testing to the morning times when it's not as busy in the pharmacy typically. There's not, or even in the medical clinic, just to kind of distance people. So it hasn't had a huge impact on patients that would come in to pick up meds in the afternoons and things like that, because we're limiting it to about 3 hours a day in the morning zone.
Okay.
James, James, I'm going to interrupt. We did get a question, and I know we're going to address this, but we might as well get to this one right now. The question related to the length of time to get results and the timing around travel. So that dynamic that exists between, people traveling, wanting to get results probably rather quickly. So what could you pose that to the panel, please?
Yeah, I think you just did. So let's start with Raheem this time.
Timing between tests, I'm always saying 3 to 5 business days. A lot of patients are asking that question: how long is it going to take? I'm traveling at this day. When should I come in? And there seems to be such like miscommunication, or just nobody's talking about this. But some airlines are 72 hours. Some other airlines are 96 hours before, and they're saying they have to get the test before then. But then they're not getting the results. So there's a big gap there, and you just have to educate the patient. Like, look, this is kind of out of my hands. What we're doing to try to mitigate that, or try to help patients a little bit with faster results: come in the morning time. Your results will leave that pharmacy that day, and you should be getting your results within 3 to 5 days. So.
Yeah. So Samar, is that what you're seeing down your end of the province as well?
Yeah. So what I've been seeing, we're in London, of course. So we ship the shipments overnight, and they get to the lab the next morning. But what I've seen is it takes 3 to 4 days. And from the past 2-3 weeks, I've noticed 3 days is more accurate. So whenever, let's say someone gets tested on a Monday, we've been seeing the results come in on Thursday. So 3 days later, and that's kind of like clockwork right now. But just like Raheem mentioned, some airlines want 72 hours, some want 96 hours, some say from the time of collection, some are from the time of the report. So it's a little stressful for everybody involved, a little confusing, but from what I've seen, we're getting our results around 3 days later.
I'm hearing like the Asian airlines are more 72 hours versus the Arab, like the Turkey and Europe is more like 96. So there's a difference of where they're traveling to.
Nice. Yeah, we joke around about how you have to be a travel agent almost part-time to figure this out, right? So
yeah. So Jag, did you have any other comments on the travel element before we move on?
No, sorry, I was just laughing because Samar and Raheem are basically saying the same thing that we've been talking about, which is this 96 hours, making sure we count backwards, make sure that the patient comes in at the right time to get the test done. That has been probably our life for the last month or so, is doing that calculation and just kind of putting patients at ease about when to come, when we would expect results to come back in, things that we're trying to do to expedite the results by, getting specimens to the lab as quickly as we possibly can, as early as possible in the day, so that the results come back faster. Those are all things that we've seen as well, and there are definitely some differences between airlines and regions of the world that people are traveling to, and it's changing as well. Last couple of days, we had some patients come in who had booked an appointment for a test, and then their airline changed their requirements, and so they had to kind of do things all over again. So it's all over the place. But I think, as pharmacists, this is what we do, though, right? It's you have people come in with all these issues and problems that they kind of just walk in with, and a part of our role is to put them at ease and kind of help them navigate whatever that issue might be. So it's kind of been what we've been doing anyways for years and years. So this is just a different topic that we're kind of focusing on now.
James, I got one more that I got privately here, and Jag and Jasneet, while you guys are up on the screen, might as well pose it to you. Is standardization within the Canadian airlines, Air Canada, WestJet. What's your opinion on that?
Well, WestJet, I haven't had anyone say that they're traveling on WestJet, because I don't even think WestJet is traveling outside of Canada at this point. I'm not entirely sure. With respect to Air Canada, where it's the areas people are traveling to usually is to Asia, not even Europe. I don't even see too many people traveling to Europe on Air Canada. It's mostly to Asia, and their requirement is 96 hours prior to travel that the patient would have had to get a test done. So it's not, I wouldn't say it's standard. I mean, there's not really standardization because it's only Air Canada that's really flying out. But the issue becomes where it's not standardized with all the other airlines that are around the world. So everybody's doing something different.
Did anybody have a patient decline international travel because their test result did not arrive on time?
We had a close call, actually. So back to how long it takes to get the results. A lot of times the lab actually has them, but since they're using fax to send them out, unfortunately, there's a huge backlog. And sometimes we call the lab and we actually get them to manually push it out to us so we get it on time. But there was actually a case where someone was traveling at 8 in the morning and we hadn't gotten the fax yet. So my colleague Ennis actually, he woke up at 3 in the morning and he logged into our computer, and there it was. We received it at 2:50 in the morning. So he emailed it to him right away and kind of saved the day. So close call, but no one got declined just yet.
Oh wow, good job, Ennis.
I've had some patients actually like leave the country and they were expecting to get the results emailed before they land, because I think that's where they're really looking for the results. So there is maybe some time lag between that. So yeah, and I've had some people just leave the country and not with the results or anything. They just left. I called them and be like, "Hey, results are in." No one's there. So
wow. All right. So I'll move on to the next question. So did you find this testing was an opportunity to attract additional patients to the pharmacy for any additional services? Let's start with Jag and Jasneet.
Yeah, I think definitely, like, when we do the testing on patients, it's also an opportunity to, explain to them what our pharmacy does and the services we can offer, and we can have that conversation. And because a lot of our results have gotten to patients fairly quickly, I think they've been very happy with the service we provided, and we've always kind of touched base and said, if you need any other assistance from the pharmacy, we are there to help you. And we've also used this opportunity, as I think Jag discussed earlier, it is flu shot season, so also using that as an opportunity to offer that service to patients as well, since they're already in the clinic. And so trying to, I guess, optimize the time we have with those patients to better serve them as much as we can.
You agree with that, Jag?
Absolutely. And I guess just further to that, I mean, there's opportunities that people are traveling. Some of them need PPE when they're traveling. So we've been able to. I'm sure we've added to some purchases where people are buying sanitizers and either gloves or whatnot, before their travel. That's for the people that are traveling. Others that are going to nursing homes, the same thing. They do need those supplies, and oftentimes they'll pick up a bottle of hand sanitizer while they're in the pharmacy. So there has been residual positive effects with more people coming through the pharmacy.
Okay, Samar, I think you mentioned that you might have gained some additional patients that you encountered while performing tests.
Yeah, so we did advertise that we're doing the testing on our Facebook page and our Google page, using the graphic that you actually kindly made for us. Thank you. So obviously a lot of people are coming in now. We're fairly new. We opened a year ago. They're seeing what we're about. They're seeing our location. They're getting to meet us. And they kind of like what they see. And as we do the test, we talk to them about their health in general. Some of them get the flu shot. We talk about other immunizations, and a lot of them actually do end up coming here. They transfer here. So they kind of like the way we help them and our attitude. So it's been great, actually, just seeing new people, and kind of our exposure has been increased in the city.
Awesome, Samar. Raheem, are you seeing a similar thing in Ottawa?
Absolutely. It's definitely bringing in new faces, different patients. I've booked a bunch of consults just based on people walking in and be like, oh, I didn't know this place existed. So it's definitely driving traffic. And, that's, again, maybe one of the selfish reasons why I wanted to do this as well. But it's definitely been positive for sure.
Yeah. So for folks who don't know, Raheem has, I think, the one and only specialty cannabis pharmacy in the country. So Raheem, when a patient walks into your pharmacy for a COVID test, how do they react to your strong branding and your uniqueness?
They're like, oh, I didn't know this is a pharmacy. This is really nice. And then like they feel really relaxed, and they just comment on like the scenery because it looks different than most pharmacies, right? And then they just kind of, some of them will just start spitting out like, oh, I have this problem. And then, you know, I'm like, okay, well, we got to get to the test here. I want you to get it out. But it definitely engages them and engages the conversation. So it's again, like you said from the previous question, it is attracting new patients and establishing a relationship with them. So.
All right. So the next question is, how do you protect staff and patients while offering the service? So, for example, limiting testing to certain times of day. And I think, Jag, you touched on that, how you're booking appointments in the morning. Is there anything else that you're doing there to make this process safe?
I mean, just, besides having the screens up in the pharmacy, which we had anyways, even prior to COVID, staff are all wearing gowns, gloves, and and masks as well. So that's something that we didn't do before, like with the gowns. Now staff are all wearing gowns and gloves. We're also keeping the patients in one side of the clinic where the we get to use a medical room, fortunately, because we have extra space in the medical rooms. So we put the patients in the medical rooms to do the COVID testing. So it's not done, in like too close to the pharmacy or in the counseling room or anything like that. It's where we take them into an actual medical room to do it. So that helps keep people separated and distance from one another as well.
Okay. And Rahim or Samar, is there anything that you want to share about how you're keeping yourselves or your teams safe?
Yeah, I mean, you can go ahead, Rahim.
We're doing it like 1 hour before we open and 1 hour after we close to keep obviously the traffic down with like potentially COVID cases. I'm assuming everyone who's getting tested for COVID, I'm assuming they have COVID. So you take those precautions, right? We're gowned up, we're PP'd up. And so they're coming to the consult room, do a quick swab, and then they're out. So it's limiting the traffic, and it's great. It's working really well in terms of like the operationalization of it.
Awesome. And Samar, go ahead.
Oh yeah, I was just gonna say, just like everyone else mentioned, obviously full PPE, face mask, gown, everything. We're strictly by appointment, using Google Calendar to book 15-minute slots, separating even flu shot patients from COVID patients, making sure there's never any overlap. So you're in for a test, 5 minutes, you're out, and no one's ever kind of waiting in the waiting room. So appointment has really helped. Scheduling has helped.
Yeah.
Okay, great. And this next question is more of an operational question, just for folks who don't know. I'll give this to Jag. Jag, who qualifies to be tested at the pharmacy?
I never go through the assessments. All the staff always does. But yeah, there's quite a few qualification pieces that you need to hit. So they have to be asymptomatic. That's priority number one. So once we determine that they're asymptomatic, they also shouldn't have been in contact with somebody that is known to have been positive for COVID. They also shouldn't have had a notification on one of their apps for maybe a positive case. So it's really limiting, patients that are likely going to be negative coming into the pharmacy. The other part of the criteria is, after we've gone through the first part, is why are they getting it done? So is it because they're working in a long-term care facility or a shelter? Are they traveling? A couple other pieces of criteria are if they're farm workers or international students, they're eligible for it as well. I think I may have missed one or two, but there's a full questionnaire that we go through to determine the eligibility. And for the most part, the inclusion criteria is either travel or long-term care. That's probably 99% of what we get.
Yeah. So one other group I don't know if you mentioned was Indigenous, people who self-identify as Indigenous.
Yeah.
So they also added congregate settings too. So
right.
If you're someone in a congregate setting, you're now eligible to get tested at the pharmacy.
Right. So if you live in a homeless shelter or a group home or those types of settings, right, Rahim?
Yeah.
Okay. So The next question, I think some of you already sort of answered, but just in case there's additional flavor you wanted to add, I'll go to you first, Samer. So which patient groups seem to be relying on testing at the pharmacy?
Yeah, so it's mainly those who are traveling internationally and those who are visiting loved ones at long-term care homes. Those are the main ones. We are getting actually quite a few requests for people that their employers are wanting them to get tested, but that doesn't fit the criteria at the moment. But yeah, mostly traveling and long-term care homes.
Okay, anybody else seeing any other types of patients in your regions you wanted to bring forward? No. So Dean, I think you had another audience question you wanted to.
Yeah, I did, James. And, we've kind of touched on it already, but again, I would just pose it to the panelists of any additional insight you might have on the impact it had on your regular patient base. Obviously that's the question of the day. It's the one that has, seen some pharmacists put up signs on their door that said, we are not doing COVID testing here. So this is really the divisive question that is sort of lingered in the minds of pharmacists on whether they should do it or not. So, maybe Rahim, can we start with you and just what your thoughts around that are?
I think when we first started discussing about doing COVID testing, some of the patients were like, "Oh, is that dangerous?" You can tell like they had their their anxieties about it. And that's pretty much one of the main reasons why I wanted to divide up the time between like opening and closing, is to separate that from the regular patient flow and to keep everyone safe and keep everyone separated. And since then it's nothing else. It's like every part of like our regular routine now. So
yeah, so I know Samer, you have to hop off. Did you have any final comment about that before we let you go and say thank you?
Yeah, so same thing. We were kind of worried that, when the population found out that we're doing it, they might be afraid to come, here because there's potentially COVID patients. But thankfully that hasn't been an issue. We've actually gotten positive feedback, thanking us for doing this and helping out the community. So it's been pretty good, thankfully. I also do see a question I can answer quickly because I actually had it today regarding the long-term care visitors. If it's 14 days from the day of the test or from the day the results are received. From what I understand, it's from the day the results are received because there is someone that is visiting at a long-term care home every 2 weeks, and she actually comes in every 10 days to get tested, knowing that the results take 4 days to come out. So, like that being said, it is from the day of the actual receipt of the results.
Yeah.
Thanks for that, Samer.
No problem.
Samer, thank you. I think you have to go play soccer now, but
I do. Yes, I have to run to the center and get a game in. So thank you so much, everybody.
Awesome. Thanks for joining us, Samer. The rest of us will carry on without you. Have a good night.
Thanks, Samer.
Thank you.
All right. So I know, Rahim, you said that you are using MedMe for screening patients. Jag, are you also using MedMe at Cooksville?
I haven't actually initiated using MedMe. I did sort of get it started, but then I think we just got really busy really quickly, and then I actually resorted to hiring a admin assistant to take phone calls and bookings. So she works basically 6 to 8 hours every day, but I think we have the volume to support it in terms of the number of calls that we're getting, and I think if it was just the regular pharmacy staff doing it, they would be bombarded with phone calls all day long and not get regular pharmacy work done. So I've actually used an admin assistant to take care of most of the work, not all of it, but the staff still have to get involved with quite a bit. Okay,
so is the admin assistant working through that OPA checklist then for the screening document?
Yeah, so she does some of the screenings, but with the volume of calls that we get, all staff that are working every day are taking calls and doing screenings, throughout the day. So she does that. She'll do the bookings. We also, just to kind of streamline things, we get labels made for all the patient information, so we're not writing anything on the requisition forms. Again, just to make things go faster. So she's involved with all those types of activities.
Great. Yeah, I think it's interesting for independent pharmacy. I think each site identifies their own efficiencies. So that's very interesting to see how each of the three pharmacies we're talking to tonight is doing things a little bit differently, but still making this work. So I'll give this next question to Jasneet. So there was an audience question asking, how is the test performed? And I know that the test in like the specimen collection in Ontario is different from what they were doing in Alberta. For most of our pharmacies, Alberta, it was a throat swab, but I think you're doing a different swab in Cooksville. So can you let us know what that is, Jasneet?
Yeah, sure. Sorry, just to add to the other question, we're also, for now, we're using like Kroll to book in patients in terms of using the calendar function, just so we have everyone kind of organized in time slots, just to, again, mediate who's coming into the clinic, the pharmacy as well. So that's one function of Kroll that we're using for now until we get going with MedMe. But to answer this question, what we're doing is an anterior nasal swab. So I think the hospital does the posterior one. So we're just doing the anterior nasal swab. So we do it in both nostrils, and then it's a very quick test. And a lot of patients who have gone to the hospital and done the hospital one really seem to like this one much better, just because, again, it's not going all the way up the nose. And so it's a quick test, and patients have also seemed to, again, like this one better just because it's less painful. So.
Yeah, I can't imagine having a nasopharyngeal swab. I know a number of us Ontarians and Canadians have had that done now, but I understand it's quite uncomfortable. The test that Jasneet described, it's just the anterior nose. So just goes in a centimeter or so and you swirl the swab around on each nostril. It's much more pleasant.
And especially for people who are going in coming in every 2 weeks because of the long-term care home requirements. Again, it's much more pleasant for them. So we're happy to be able to offer that service to the patients.
Awesome.
A lot of patients sit down and like, oh, wow, this doesn't go that deep. This is so much easier.
Yes.
A lot of them are getting used to getting their brain poked. So they're much happier at the pharmacy level for sure.
Yeah, so Raheem, since we have you there now, I'll ask you the next question. So what's the process for obtaining specimen kits and ordering labs?
There is a link that was provided by the OPA on their document that connects you directly to the eHealth ordering center. So then you would place your orders for PPE, specimens, anything you may need from the actual Ontario Ministry of Health, and they will send that directly to your site. So it's a super easy process. I have that bookmarked on my computer here. But the first time I ordered, I probably ordered about 500 kits or so. So it's holding me for some good time right now. And they tell you that, like, don't keep ordering every week. Just do one big bulk order and get it over with. And as you get down towards like a 5 to 7 day supply, then you can start reordering. So.
All right, Jag, I'll give the next question to you. So what happens to the specimen after it's been collected?
So after collecting the specimen, so we get, part of the kit is specimen collection bags. So the specimen gets put into a Ziploc bag, which has an outside sleeve for the requisition form, which has already been filled out prior to doing the test. So we just pack that up. The specimen in the bag gets put into a cooler. And once we've gone through our set of tests for the day, that cooler would get sent out to the lab for the testing. Pretty easy process.
Yeah, and one thing very different in Ontario, if we compare to Alberta, in Alberta, pharmacies were working with local labs in their communities, but here in Ontario, every pharmacy that's doing the testing is shipping to a central lab that handles the specimens from there on. So it's not as simple. All of the pharmacies had to become experts at cold chain shipping and have relationships with a Purelator type company, and be careful to get the the specimens to the lab central location as soon as possible so that those patients waiting for results could get them in a timely manner. Raheem, did you have any comment about that whole process?
Yeah, that was a very confusing process in the beginning. We were trying to reach out to different companies like ATS and DHL, things like that. So I've been using Purolator. It's been working fine. I can, submit an online an online form, print out the label. I think now there's been recent communication that OPA has solidified some sort of logistical like solution. So that's going to help out a lot in terms of, where to do it and how to do it. It definitely was a big question in the beginning. It definitely delayed me from actually starting to test because I didn't know how, where, and when to do it. But it's been streamlined now, so I think it's on the right path.
Awesome. Yeah, that was a bit of chaos at the beginning, trying to figure out the shipping. Dean, did you want to?
We have a question that has come into the chat box about any rejected specimens. Anything that has come back to any of our panelists. That the test couldn't be completed. It's it's sort of in that. It's not a positive. It's not a negative. It's just undetermined.
Yes, I've had one patient that had rejection. At this time, I forgot what the actual rejection was, but it just said you need to resample. Like we couldn't test it, so I wasn't sure what the issue was. So I had to explain that to the patient. You have to come back in and retest. So they're okay with it.
How about you at Cooksville, Jag or Jasneet?
Rejections. I mean, all the rejection that we've gotten were because either myself or Jasneet, one of us didn't put the lid on tightly enough and the specimen leaked in the bag. So the test had to be redone as a result. Fortunately, these people were not traveling, so it wasn't it wasn't a huge issue for them to come back to get retested. But that's the only rejection that we've gotten is if the specimen leaked in the bag.
Yeah, that's really important to mention if anyone's getting into testing. Other reasons your specimen could be rejected would be if something was not filled in correctly on the requisition form. So there's very specific requirements for that form. So if it wasn't done correctly, that could result in a rejection as well. So next question, Jasneet, I'm going to give it to you. So what are the pharmacies or the pharmacists' responsibilities for handling test results?
For us, what we've been doing is when the results do get faxed to us, we contact the patients right away and we phone them and ask them to pick up the hard copy report, just because a lot of our patients are traveling, and so a lot of these airlines require some sort of formal report indicating whether it's detected or not detected. So we've been packaging that up for the patients, and when they do come in, we ask for some personal ID just to make sure the right patient is getting it, and that's how we've been facilitating it with our patients.
Okay, great. And I know that folks who have a green health card, they can look up their test results on an online portal. However, if it is a positive result, that the pharmacy is responsible for communicating that to the patient and giving them some directions. So I know that some of you have identified positive test results. So can you tell me what was the process with that? And I think maybe Jag had our first positive among the banner. So how did that process go in informing the patient?
Well, I mean, when we get our faxes, they're usually bundled with maybe 10 or 15 results. So the first thing we do is go through all the results, make sure if there are any positive results, that goes right to the top of the pile. Fortunately, I would say 99.5% are probably negative. So the positive that we did get, it was just a matter of making sure that we connect with the patient right away, give them instructions as to what to do in terms of isolation, monitoring for symptoms, notifying people that they can notify if they were in contact with them, and also informing them that like the public health lab or public health would be potentially calling them as well, just to kind of review what they need to do. So that's, and then we would follow up with that patient for the next couple of days just to monitoring for symptoms, but also just to, make sure that they are okay, they don't have any questions as a result of the positive.
Okay. And
Jack, there was a follow-up question that came in, and it was around billing. And if in a case where an individual had a rejected test, and Rahim, you had one, and Jag and Jasneet, you guys had one as well. Is there any issues with rebilling to ODB or the ministry?
No, there's no issues with that. I mean, I guess the criteria is any patient is allowed to get one test done on a daily basis, and I think as long as you're not billing a specimen or assessment twice in one day, it's totally fine. So there was never an issue because the rejection, we wouldn't have gotten the notification of that rejection until the next day anyway. So it would have been totally fine to bill it again.
Yeah.
Rahim, did you have any positive results there in Ottawa?
No, not yet. Knock on wood. Thank you. But
Okay.
no. No, go ahead.
Okay, so I'm going to give you one more question for each of you, and then I'll toss it to Dean for some closing remarks. So I know we've covered a lot of ground, and I'm sure we could keep going, but does anybody have any regrets about COVID testing? Is this something you'd suggest other pharmacies enroll for if there's a phase 3? So let's start with Jag, and then we'll go Jasneet and Rahim last.
No, I wouldn't say I have any, hesitation to, starting up COVID testing. I think it's something that has been a positive for us, in terms of bringing new faces into the pharmacy, building new relationships with patients that are, in the community, but they never used to come to our pharmacy. So that's been a positive. If I were to look at it sort of high level, I think being one of the first group of pharmacies to start off, there was some hardships, I guess, in terms of what to do and how to do things. But once we've got the flow kind of streamlined, I think it's been pretty smooth so far. So anyone new that was going to start in the next couple of weeks, if there are new pharmacies doing it, I think there's a lot of there's a lot of best practices out there now that anyone could reach out and really be able to have a smooth flow right from day one.
And Jasneet, same question to you. So any regrets about your role in all of this? And is this something you'd suggest other staff pharmacists step up and engage with?
Yeah, definitely. Everything kind of Jag covered, kind of everything, the same sentiments. Same thing. There's no regrets. I think it's actually been really good, and in the sense that, again, we are considered one of the most accessible healthcare professionals. So being able to step up during this time and alleviate some of the stress on some of the other centers has been very positive. And again, we've gotten so much positive feedback from, new faces as well as other patients who have come into our pharmacy. Again, relating back to some of the big box stores, a lot of people have said it's like 2-3 weeks of a wait time. So being able to be so accessible and also efficiently do the tests and quickly get them the results, it just feels good knowing that we're able to have that positive impact on the community. Awesome,
Jasneet, and we'll go to you last, Rahim.
Same. It's been amazing. I think I have absolutely no regrets. I would do this over and over again, and I'm really proud of OPA, and I'm really proud of our association for advocating for this. And I think it boosts our profession, and boosts our our accessibility, it boosts everything. I'm proud to be rolling it out first with all you guys, and I think it's just going to enhance our profession in the long run. So yeah, nothing but positivity on this side.
James, we had one last question sort of that was just posed. It's around rapid testing, and we've all heard about things that are going on in the rest of the world, and Canada perhaps even lagging a little bit behind when it comes to testing efficiency. And I'm sure you guys have all become great students in what's going on elsewhere around COVID-19 testing. Rahim, any comments on rapid testing that you've heard?
I would love to do it. I would love to do it. I think we should be doing it 100%. I'm wondering, I noticed Health Canada did approve a rapid test. I'm not sure where that is, a line of either our scope or where it can be rolled out, but I think they would really improve efficiencies. Just like a lot of other patients have been reporting, especially the travel patients, that this is super inefficient. And to be honest, I think the ministry is spending a lot of money on this, and I feel like that could really help save their budget a little bit if they did rapid testing. I don't know if James, I don't know if you know of anything, any new developments within like either OCP or anything like that, is that coming to the pharmacy? And if it is, are we allowed to do it?
I haven't seen anything suggesting it's coming to pharmacy, but Dean, maybe you can share what you know about the pilot in the airports.
Well, and this harkens back to, the whole question about the 14-day quarantine and, the fact that many Canadians, they just don't want to travel. As travel opens up, we're still subject to a 14-day quarantine. And, the government has started a pilot project at the Calgary International Airport to at least shorten that quarantine period down to 7 days. And from what I understand, a lot of it is based around the National Hockey League, who is very, very interested in what's going on in Calgary in order to kind of start their season again. And so I think we're all sort of looking forward to finding out what those results are. And, it's nothing more than just as you land in Calgary, getting tested and, another 6 days later, getting tested again. And, if you go negative, you're good. You're on your way and there's no quarantine required. So it's, I think kudos to the various governments, and I assume it's a collaborative project between the government of Alberta and the federal government about shortening that quarantine period.
Yeah, awesome. So I'm going to have a final remark, and then Dean, I'll pass it over to you for the ultimate say. But I just want to say, Rahim, Jag, Jasneet, Samer, and our other pharmacists involved in testing that couldn't join us tonight, whether that's Enis or Ahmed or Doa or others that are still coming on board. I'm very proud to support operations for all of you. And I think you're all making incredible contributions in your communities. And we've heard some of those stories tonight, but I know there's many, many more of how you've helped folks try and, continue to thrive as best as they can in this strange environment with COVID that we're all trying to live. We're trying to see our families. We're trying to travel when we need to. And I think that you've really made a difference. And Dean, I'll turn that over to you.
Thanks, James. And just as a final comment, and I too would like to echo James's comments, and Rahim, Jag, Jasneet, Samer, Manoj, other people within our banner that have stepped up on this. I've been around the advocacy game in pharmacy for many, many years, and I've often said that the best thing that ever happened for advocacy in pharmacy is when flu shots were introduced into pharmacy in 2012. And I think COVID testing, kind of falls under that same category. And, whether you do it or you don't do it, that's your own personal, professional decision to make. But boy, on behalf of, I think the profession of pharmacy, all of you, Rahim and Jag, Jasneet, Samer, and all the rest of, and, including everybody else that's doing it. It's been something great to see. Hopefully the government notices. It's initiatives like this that really make a difference in our profession. And, as we drive forward and, get more recognition, with areas of expanded scope, this helps in a big way. And I can honestly say that to everybody, listening and watching, that, it's things like this that make a huge, huge difference. And, to see independent pharmacists step up, it's a great, great thing. And, at Whole Health, our personality is to do things different. And, we want to open as many doors as we can to pharmacists to do innovative things. And boy, this sure fits that that criteria. So once again, you know, we do a lot of these webinars. Tonight's was very unique. It was a Q&A, but many times we present on many, many different topics. So I would encourage everybody to sort of watch for them. You know, if you're interested in our banner, we're certainly interested in you. And we have a saying at Whole Health that there's always something exciting happening at Whole Health. So please look into us as a banner, as an organization, because as an independent pharmacist, I don't think you'll be disappointed. And thanks for all the questions. We had a lot. We could have gone on, but we don't want to take too much more of your evening. And James, that's it from me.
That's a wrap. Okay. Thank you, everybody. Good night.
Thanks.
Thanks.
you.
Bye.
Good night.